Welcome to the Future Tech edition of the Finding Genius podcast. Forget frequently asked questions. Forget common sense, common knowledge, or Googling for information. How about advice from a genius in their field instead? 95% of people in any profession are good enough to be qualified and licensed. 5% go above and beyond. They become very good at what they do, but only 0.1% are the geniuses of their profession. Richard has made it his life's mission to interview the geniuses of their fields in areas such as AI, 3D printing, quantum computing, blockchain and Bitcoin, and more. Don't miss out on amazing podcasts with geniuses. Review us on iTunes or wherever you listen, and go to futuretech.findinggeniuspodcast.com and subscribe today.
Hello, this is Richard Jacobs with the Future Tech and Finding Genius podcast series. I have Daniel Griffin. He had an eclectic background. He does many things. He's an author, associate research scientist, and instructor in clinical medicine. He has his own company. He's an expert on infectious diseases with a focus on HIV and tropical medicine. So, Daniel, thanks for coming. How are you doing?
Oh, I'm doing well. Thank you for having me on the show.
Yeah, tell me a little bit more about your background, because you mentioned offline there's at least 3 main initiatives that you're involved in. So what are they?
Yeah, I wear a lot of hats. I like to think of myself primarily as a physician, but I guess physician scientist, educator. But I'm at Columbia University, where I do teaching, clinical medical instructor, but I also have an active research lab. I work with Stephen Goff, who's a Howard Hughes funded researcher, but I'm also the chief of infectious disease at ProHealth. I'm the president of a not-for-profit, Parasites Without Borders, and I do a lot of clinical medicine in the States as well as a bit overseas.
Okay. And what's in the world of, what's your current focus of the projects you're working on? What is most interesting to you that we can talk about?
Yeah, you'd mentioned offline before we started speaking that you had at one point spoken with Peter Hotez, who's a pretty prominent figure in global health and tropical medicine. And I think the area that has gotten me the most fired up, the most passionate about is all these, we call them tropical or parasitic or neglected diseases, ranging from all the different helminths and protozoal diseases that we see outside the country, but actually that we see quite often in the country.
So you mentioned helminths, meaning worms, but so in the U.S., are there any common parasitic infections or infectious diseases that usually are in the tropics? Like, what would you focus on here?
It's very interesting when you practice in New York City. I just got back from teaching at University of Glasgow in Scotland, and I was teaching for they have a diploma in tropical medicine and hygiene class. And I do a series of lectures, and one of the lectures I do is the idea of New York City as the center of the developing world, where people come really from everywhere to New York City. It's a plane flight away. So within 24 hours, they've gone from wherever they are to New York City. And I had an interesting experience a few years back when I was working in an HIV clinic. And I asked one of the patients who I saw was from Nigeria. And I said, "Oh, gosh, when was the last time you were back in Nigeria?" And they looked at me a little funny. They said, "You know what, Dr. Griffin, I live in Nigeria. I just come here every 3 months to see you." And so really interesting. I realized several of my patients did that. So here you are in New York City, but patients may be living somewhere else, and they're coming here periodically, or they're coming here to visit, and they're coming straight from West Africa, Southeast Asia, South America. Apparently the Dominican Republic, there's quite a referral pattern between the Dominican Republic and New York City.
Huh. I guess there's health tourism in the U.S. as well. Makes sense.
Yeah, so there's health tourism, and there's also all the other tourism. So we'll be working in the city, and a woman will come in with periodic fevers and shaking chills, and you'll do a blood smear, and she's got malaria because she just got off a plane from Ghana. Or they'll come in and they'll have fever and a rash, and maybe they'll have dengue or chikungunya, or during the outbreak we saw quite a number of Zika infected pregnant women. So it's amazing in New York City. and the surrounding areas.
So in your role as a healthcare provider with these infectious diseases, are you always, you have an obligation to like alert the CDC and tally any strange infectious diseases you see? Like, this is not just like I go to the doctor, I have a cold. This is seemingly, at least to most people, very unique. And I would think there might be a worry of that kind of stuff spreading. I don't know.
You know, that is an interesting concern. And there are certain diseases that I will say our public health system does a really good job of tracking. You know, we're always particularly concerned about sexually transmitted diseases, right? So syphilis, things like that. We're also very concerned about diseases such as tuberculosis, which can spread. And we've now reached a point where the majority of cases of tuberculosis which we see on a regular basis in this area, are now people that were born somewhere else, moved here, which is a shift from just a few years ago when it was our more senior, U.S. residents that would have reactivation from being young. So they're good about those things. Certain diseases are not, not as, I should say, not reportable. So it depends upon what you're seeing. Right now, we're in the midst of this coronavirus outbreak, and we're starting to see a few cases in the U.S. So those, you're sending your testing to the CDC, so you're immediately part of the whole monitoring and surveillance network.
I think that's why I asked you, is because, we're talking about it. Well, so it's on my mind. That's why I was curious about it.
Yeah, no, okay. If anything, I wish we had I will say, a more robust ability to track what's going on. Not that to violate anyone's privacy or anything, but just it's helpful to know what's going on as a healthcare provider, so that you recognize it, so that it doesn't go for a few weeks or there's a bunch of different cases. And I remember early in the HIV epidemic, there was some odd signal out there, but there wasn't maybe the communication, the tracking, and so there was a little bit of a delay there. And I think that in this current epidemic, I think they've done, sounds like a very good job of quickly recognizing that something different was going on, figuring out what it was, and jumping right on top of it. But the amazing thing is how many of these tropical diseases occur every day. In fact, we probably lose 1,000 people every day to malaria. So I'd say more, because we have about 500,000 deaths a year. We right now in the U.S., when we get to the height of the flu season, we saw about 60,000 deaths last winter from the flu, which works out to about 1,000 deaths a day. And I think it would be nice not only if we had better recognition, but we also had a better way of letting people know. It might not make a great news story, but it might make sense for people to be aware of what's going on health-wise, so they're not just getting it from stories that are exciting, for the media, exciting to print in the news.
Well, I was listening to like the John Batchelor show, when they talked about the normal incidence of flu has caused thousands of deaths in the time that a few people have died from coronavirus, but everyone's freaking out about corona when the deaths are minimal compared to flu, at least so far. So it sounds like it would put things in context if people knew what the main causes of death and disease were.
No, I think that's true. And I know, if you spoke to Peter, you probably got the appreciation that some of these diseases, like the helminths, the large intestinal worms, we're talking about 1 billion or 2 people, currently suffering with this. You look at numbers like that and, you say, well, we're in the thousands with the coronavirus, but we're in the billions with some of these intestinal worms. So they refer to the unholy trinity. So, ascaris and hookworm and whipworm. And, so it's, I think that's what I get passionate about. There's so many urgent health issues. And it's, some of it's global, but some of it's right here in the U.S., particularly the areas of the South where there's a lot of income inequity. You may remember the story when there was a North Korean soldier who defected and he came across and then they found that he had a bunch of intestinal worms and they said, oh my gosh, what horrible conditions, this gentleman has. And I was like, oh, did he escape from North Korea or, Alabama, where some of our, own citizens are heavily infected like this?
Really?
So it's amazing that we were about North Korea, but what about our own people? I get passionate about the inequities, I think, and how many people suffer,
So, all right. So, what's your focus? Are you doing any research, or is it all clinical work? And regardless, what's your focus?
I do a combination. So, I am active doing research. I've got there's just a paper recently published on malaria in birds, and there's another paper right now, hopefully under final review at the virology journal. But I have to say, I probably spend an inordinate amount of time on education. And so the concept of the Parasites Without Borders is that you can go out there as an individual and you can take care of X number of patients a day. But if you can educate others, particularly other clinicians, sort of this exponential potential. So if people are aware of all these different infections and clinicians are aware of how to recognize, diagnose, treat them, and intervene, I see that as having a tremendous potential to make a difference. So a few years ago, I got together with actually Peter Hotez, Dixon Despommier, Charles Knersch, Robert Guadz, and a textbook that had sort of fallen out of print, hadn't been printed for a while. We actually resurrected it, and now the last two editions, there's over 40,000 copies that have distributed throughout the world, and a lot of these hardcover copies to areas of the world where there's limited internet access, where there's limited access to education. And I have to say that makes me really optimistic that we're getting this education out there into the hands. We like to say getting knowledge to the people in places that need it the most.
So, okay. When it comes to education now, where's the misinformation or the lack of education? What is it like? What does your curriculum look like? Yeah. What does it look like?
Yeah. So, we have two main focuses that where we've been, and one is the we I guess updated this parasitic diseases textbook. There's a sixth, now a seventh edition. And so from the parasitic diseases, the whole textbook is really evidence-based, thousands of references, really looking at, I know sometimes science and evidence gets a bad rap these days, but, these are, therapies that have been looked at and effective and can really make a difference. Because you do worry, and I worry, in the area of parasitic diseases, people get quite desperate at times. And there's a lot of people ready to take advantage of that desperation and offer therapies for people with and without parasites that may or may not work. And so we're trying to get the actual information, the science, what are these organisms, how do you understand them, and then understanding them, what actually works and makes a difference. And we have distributed that textbook, as mentioned, to thousands. And actually, over 100 countries throughout the world now have had hardcover copies sent to medical schools, individual clinicians. And we coupled that with actually an online video series. So Dixon Despommier and I created a video series. It's free, distributed throughout the world, where if you learn better in that format, instead of reading a chapter, you can just sit there and listen and learn all about whatever parasite, each chapter has its own video associated with it. And
right,
then
so in the U.S., which parasites are should be the most concern to people? And how do people get them?
Yeah, so a lot of the parasites, the big parasites still in the world, one of the top three killers is malaria. And that's killing about 500,000 kids, mainly kids, about 500,000 kids per year die of malaria, and which is huge. It's up there. Tuberculosis, HIV, and malaria are still the top three killers throughout the world. And I think a lot of people only worry about it. I'm going to take a trip to Africa, but they don't necessarily worry about the impact that has. The other that I mentioned, maybe not so much a killer, but a cause of tremendous amounts of disability, are these intestinal worms. And then a big one, actually, schistosomiasis, which people are swimming in fresh water, and they're actually getting this parasite invading through the skin and then causing scarring of the liver and protuberant bellies. And I should always mention, though we're really making some progress, this is the disease that my son is most afraid of. He's 14. But this is what happens when your dad is a parasitologist. You get bitten by a mosquito, you get infected by this filarial worm, which then the adults live in the lymphatics, and it causes scarring. And not only can you get your legs, the elephantiasis, but your scrotum can become often so large that it requires a wheelbarrow to transport it around.
Yeah.
So after meeting Jimmy Carter a couple of years ago, I went to this exhibit that the Carter Center had set up in New York, and I took my son, and I guess to this day, that's one of his fears is after he saw all these photographs.
Yeah, I'm sure. Yeah.
Yeah, and I mean, you can imagine in these countries, having a malady like that. I mean, how do you go about your life?
Well, so going back first, you said the top three killers are still HIV, tuberculosis, and malaria. If you live in the U.S., for instance, and one of these things happens to you, how treatable are they?
That is a big thing. If you have the resources, I will say very treatable. So malaria in the United States, properly diagnosed, properly treated, you should be able to cure people almost 100% of the time. Tuberculosis, again, if it's approached correctly, I would say the vast majority will have drug regimens that are available, and people will get better. We are starting to have an issue with multi-drug and actually XDR, so very multi-drug resistant tuberculosis, and that in a few cases is something that we really have trouble treating, but usually not. And then HIV, it's interesting. In the United States, we should be able to do a tremendous job. And in areas of Africa, I'll use Botswana as an example, they have this 90-90-90 approach where they say, we want 90% of the people who are infected to know their status. We want 90% of them to be on medication. And we want 90% of those people to have their virus completely suppressed and have the disease under control. In the United States, particularly in parts of the New York area, we're in the 70% of people even are aware of the infection. And then we don't do great with getting them on medicine, and we don't always do great at having them under control. I hate to say Botswana does better on all three counts. And in the United States, we have over 1 million people infected with HIV, and people seem to be talking about, the epidemic being over. And over 1 million people infected with HIV, 40, 50,000 new cases every year in the U.S. alone. I'm not sure that the epidemic is over. So we should be able to do better than we actually do.
I was about to say that. I haven't really heard much about HIV. I guess in my mind, not knowing, I assume, okay, now there's ways to treat it so you can live with it forever and it's no big deal. But it sounds like it still is a very big deal. What is the state of the art with treatment if you do have AIDS? How treatable is it? And you just have to live with it for the rest of your life? Or what's the the state of the art?
Yeah. It's, there was an isolated, we call the German patient, where there was actually a cure. It's a very sort of complicated story. But in general, for the 30 to 40 million people infected with HIV, it's lifelong suppressive therapy with usually a 3-medicine regimen. And nowadays, a lot of times these 3 medicines can be in a single tablet that you take once a day. They're usually quite well tolerated. So tremendous. I grew up in Greenwich Village, and I will say that it has just been a dramatic transformation. Because when I was a kid in Greenwich Village, it was a death sentence, and it was a death sentence very quickly in a matter of a couple years. And this has been tremendous, the amount of progress we've made, but we're not quite there yet.
Okay.
When I should jump in. When I go to some of the areas in Africa. So eastern Uganda, where I was in the fall, areas like that, it had been as high as 20% of the population was infected. Now it's down to 10%, which is one, decreasing transmission. Number two is a lot of people died. So, progress, depending on how you look at it.
Yeah, so these 3 top killers, malaria, tuberculosis, and AIDS, which countries are in, I guess the worst shape in terms of addressing the problems? And what's the toll that it's taking?
Yeah, the area of the world where it's all concentrated is sub-Saharan Africa, actually. And in a lot of those areas, it's really been devastating to the people and the economy, and then the people again because of the devastation to the economy. So, we see malaria in Southeast Asia. We see tuberculosis in Southeast Asia. That would be sort of the second highest incidence. And there are certain areas, I'll say, in South America. There's an area outside of Lima, which has not only tuberculosis, but really high drug resistance rates of tuberculosis. Haiti has a lot of issues with tuberculosis and HIV, and that's a place I think that Paul Farmer has done a lot, has made a big investment in.
Okay. And then we talked about the 3 top killers, but you said parasitic worms in the U.S. Are there, like you said, even in people in Alabama, for instance, may have problems with that. Where would we have contact with worms, and how would we get parasites here, for instance, in the U.S.?
Yeah, it's interesting because, we talk about what kills you, and sometimes there are things, worse than death, and it's years and years of suffering and disability. And a lot of our parasitic diseases, they won't necessarily kill you, but they will disable you. They'll make you unable to work. They'll cause suffering and pain. And the southern part of the U.S., actually, probably the reason why Washington is where it is was we had malaria in the whole south of the U.S. We got rid of malaria, but then we also had a lot of hookworm and ascaris, these intestinal worms, and it's improved in the bigger cities. It's improved really, I would say, through hygiene and toilets and things like that. But there's still areas in the southern U.S. There's areas, we'll say, up in West Virginia, areas where poverty is still at the point where people don't have shoes, where people don't actually have adequate sanitation. And because of that, there was actually it was a New York Times article about a year or two back where they covered a community in Alabama where they looked at what was the incidence of these intestinal worms in this community, and a third of the people were infected. Here we are in the United States where people, they own private planes and drive around in fancy cars, and yet parts of our country, because of the lack of infrastructure and sanitation, are still suffering with these diseases and not even necessarily being recognized and treated.
So
there was...
Yeah, go ahead. What do you think would be the, how can we make an impact here? How are you making an impact?
Yeah. So one of the things is to increase awareness. My hope is that people hear about this and they say, oh, this can't be true. And they look at it and say, oh my gosh, this shouldn't be true. And then they're willing to sort of do the next step. What can I do about getting the word out and letting people know and making sure this doesn't happen in our country? And so we're doing it in, I think, an awareness campaign more than anything, letting people know that this is a problem, letting clinicians know that these neglected peoples are throughout the world, but even here in the United States, and then trying to get it to that next level where something is done about it.
Well, again, what are some things that people could do to help themselves?
Yeah, well, one of the first things is, like we talked about with HIV, people are like, oh, I think this is over, we don't have to worry about it. So there are a lot of people, certainly say, who think they have parasites who don't. But there are people who are, in these areas of our country where they feel tired and they don't have the energy to go to work, and they may actually end up having an infection. So it's, go to see the doctor and let them know, I don't feel right and I feel tired and maybe I have diarrhea or whatever it might be, and getting diagnosed. And unfortunately, I see people that have been bouncing around to multiple clinicians, and then you finally come to me and I'm like, okay, well, let's do the proper testing. Let's see if you have it. And then, finally making the diagnosis and treating them. But I'd like to see more people aware, and I'd like to see more clinicians aware that even in the United States, we have parasitic diseases that can be recognized, treated, cured, and then people can, move forward with their lives.
Well, what are some of the parasitic diseases that look like what doctors may say, oh, that's fibromyalgia, or that's idiopathic, we don't know, or, my feeling is maybe some of these are similar to other stuff, and that's why doctors assume, oh, no one's going to have that here in the U.S., so they don't bother to test.
One of the things that I see quite often, I feel sort of bad about this, is we still have a fair amount of scabies in the United States, and I feel like it comes and goes. Like we see a bit of it, it gets recognized, people get treated, and we had a young lady, I'll say she's in her 20s. I like to think that's still young. I like to think that's very young as I get farther from my 20s. And she had woken up with this horrible rash over her whole body. And she was supposed to actually be working a weekend job, but she calls, I can't do this. I have this horrible rash. And so she goes to the first doctor, and they say, oh, you're allergic to something. And they give her some medicine. Goes to the next doctor. They give her steroids. You got to see an allergist. They do this workup where they're like poking her with all the needles, and $1,000 later, she finally goes back to her primary care doc, and her primary care doc looks at her hands and says, "Oh my gosh, what are these things between your, the webbing of your fingers?" And she basically had scabies burrows between the webbings of her fingers, and that's when I got the call. And she had scabies. So take this.
What is that?
This medicine. So what scabies is it's actually we call it an ectoparasite. It's an arthropod that actually burrows into your skin, and you get it from another person, so it's transmitted person to person. And in the U.S., the manifestation is usually these burrows between the fingers. Sometimes you can end up with an itchy scalp, and you have an immune response to basically this insect, which is burrowing into your fingers. And that was the whole rash. And in some of these areas where I go, and I'll say in Panama, where I go every March, when they first went to these communities, this organization, Floating Doctors, 20% of the people were heavily infested with this ectoparasite.
It's crazy.
And the mothers would come in beside themselves. It's like, I just can't handle this. It's hard enough to have a kid, right, when you have like modern conveniences. But here in these little villages, no running water, no electricity, just barely getting by. And you can't sleep at night because your kids are all just scratching because they're covered in ectoparasites.
Huh.
And now we go back as a success. And, you see a clinic, you see 100 people a day, you might see a couple with scabies. But we see that here in the U.S., and people seem to just not recognize it until, they finally come to someone who pays attention. So that's a bad one. I will.
What do you, if someone has a problem where they think they have a parasite or something wrong, like what kind of doctor should they go see? Like, what are you called? What do you describe it as?
You would want to see an infectious disease specialist. Hopefully you want to see someone who's had training in tropical medicine. Because some of these parasites are not covered in the standard curriculum, which again is our educational effort. We're trying to get information out there to doctors that might not have gotten it in their formal training, while they're studying molecular biology and all the personalized medicine. And, this is personalized medicine too. That woman certainly needed that medicine. And I think to find, people sort of, how do I find someone who has that extra training, not just infectious disease? Right. But there's a large organization, I think it's the largest one in the world, the American Society of Tropical Medicine and Hygiene, so ASTMNH.org. And they actually have a listing of sort of those of us that have, in addition to medical training, gone on and gotten tropical medicine training, actually gone through and, rigorous examination and, shown that we have expertise above kind of the common things that you might see.
Okay. And what's the best way for people to find out more about you specifically and your work and the organizations you're part of?
Yeah, probably the best thing is to go to the www.parasiteswithoutborders.com, and that has a lot of information, and it gives you access to the parasitic disease textbook, also gives you access, again, for free to the limited resource medical handbook, and then access to all the lectures on parasites, all the lectures on all the different diseases that might be managed in limited resource settings, and also a bunch of other fun books about measles and, other contagious diseases that people might be interested in. And I guess we have a podcast too, right? So this week in parasitism, part of the microbe TV empire.
Okay. Interesting. I didn't even know that. Right. This week in parasitism. Okay. Very interesting.
Yeah, with over 2 million downloads. So.
Wow. All right.
I'm not sure why that many people want to listen, but apparently people like parasites.
Yeah. Well, Daniel, thank you for coming, and I'm glad that you and people like Peter Hotez, et cetera, are working and caring about this stuff that, maybe in the U.S. it doesn't affect as many people, but worldwide it's a huge, terrible toll on humanity. So thank you for what you do, and I appreciate you being here.
No, thank you for having me on the podcast. Hopefully this will help, again, get the word out, get people aware of these challenges.
You've been listening to the Future Tech edition of the Finding Genius podcast. This podcast is information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed. Review us on iTunes or wherever you listen, and subscribe today by going to futuretech.findinggeniuspodcast.com.